Hi. Genius Lane Early Years Solution is dedicated to provide evidence-based information to parents, schools, therapists, psychologists, and pediatricians. Because they are involved in the early years of children, and often it is really important for them to understand the difficulties of the child if their development is behind or deviated. And just by addressing this, we have seen significant improvement in the lives of children, in the difficulties or impairment that they will experience, as well as preventing and reducing mental health when they grow up. The reason why this is important is because early on the child's development is taking place in their mother's womb, in an environment surrounded by water, and they have a big transition at birth. The most difficult time for a child when the child has to take their first breath, and some children can experience breathing delay, which can result in a permanent damage in the brain. This is called cerebral palsy, and in this section of our web page we will talk about what are the child's difficulties and how it presents at different ages, and what will early intervention mean if a child has had a brain damage or a brain injury at birth or in the first year of life. So because children are different from adults, all children go through changes in their brain. So the brain continues to develop in the first year, and the head size of a baby increases by about 10 centimeters in the first year of life, which shows the importance of the early years. And after that, for the first few years, the brain continues to mature, the pathways continue to develop, which makes or builds the foundation for the child, and it is relevant to the child, to their family, and to the society. So there are two types of difficulties or diagnoses in children which can cause neurodevelopmental problems or neurodisability. So one, if the child has got a global delay or a global impairment, and one in which the child has got a specific delay or a specific impairment. So to make it simple for this course, we have divided this into a global delay where we will talk about conditions such as Down syndrome or other genetic problems which can affect children. And we have section on specific delay where we talk about autism. We talk about specific learning problems such as dyslexia, dyscalculia, dyspraxia, or developmental coordination, ADHD. And we will understand the basics of diagnosis based on the latest diagnostic criteria, and what does it actually mean for the child. It is really important that all children have the correct diagnosis and profiling. So for the pediatricians, we have made sense of the diagnostic criteria and why it is important for children to have the correct diagnosis and correct profiling, and not to use the diagnosis loosely, because the diagnosis has implications on the child's strength and weaknesses, and the diagnosis has implication of what strategies the therapist will do, and the diagnosis has implication on the future difficulties of the child. So what is early intervention? So early intervention means that if a child whose brain is developing, they get an opportunity to develop and thrive so that they achieve their best potential. It is important to understand that every child's brain is different and they will have their own strengths and difficulties. And often when they are in a fixed environment at school, when they have to meet targets, they start feeling that they are not good enough. So often there is a primary problem and often there is a secondary problem. So with every diagnosis, we will cover that and we will provide strategies to prevent the secondary problem for the child if the child has got a neurodiversity. So early intervention means that once the child has been seen by a specialist and once the child has a neurodiagnosis, then what do we do to address their difficulties based on their weaknesses and strengths profile, so that it builds the brain in a way that the child has less and less difficulties in the future. What we do not cover in this section of the course is how you deal with complex neurodisability where the brain damage is in all areas of the brain, or the child has got a progressive neurological problem or a neurometabolic problem or a problem of the spine or the muscle or the nerves, the peripheral nervous system. So we are only focused on the brain because it is developing and it is changing. So this talk will talk about cerebral palsy. It will talk about conditions causing global development delay. Important to understand that global development delay is just an umbrella word and does not include one diagnosis. And we will talk about autism. And it is important to understand that what autism actually means to the child and the difficulties changes with age. And by early identification of autism, we need to understand what is their profile. So usually with autism, we find children early on to have a speech delay or to have a rigid behavior, and often we just don't know what to do with these children because they have difficulties almost everything. It could be starting from sleeping, brushing, eating. How we address these difficulties in children is going to shape up their brain. So we will learn about the child's difficulties in this course, and we'll learn about all the strategies that we need to do and that can give you a long-term resolution. Otherwise, in autism, one difficulty goes and other comes, and one goes and other comes, and we are in a cycle and a loop for a very long time. So this course is built on experience of thousands of children that I have encountered and developed very simple strategies to address the primary and the secondary problems in autism. And with that, we have seen really good outcomes by just addressing the secondary problem from not developing. So in autism, the secondary problem is usually high level of anxiety and repetitive obsessive behavior, which causes impairment. The other thing we'll learn in this course is about specific learning problems. So there are some children who might have strength of visual learning or kinesthetic learning styles. They are struggling at school. They are finding that they are not good enough. And I meet a lot of adults who take pride in saying that they are visualizers, they are problem solvers, but school life was very tough for them. So what can we do for them? How can we identify them? How can we provide a classroom environment that can nurture them? How can we help the parents understand those children? And those children are about 10 to 15% of all children. And without understanding these children live with long-term feeling that they are not good enough or they were not good enough. And they will make wrong choices as adults. So by understanding and addressing this, we can actually improve the mental health in these children. And often they are mislabeled or quickly labeled at ADHD. So there are thousands of children I see in my clinic who are only 2 or 3 or 4, and the family strongly feels that, oh, this is only ADHD. But without understanding the gaps, without understanding the child's strength and weakness, we are not providing the right environment for the child's to grow, or the child's brain to achieve its full potential. And that is something that I will cover through the courses on the Genius Lane early years courses. So thank you for watching this video, and I hope that it helps you, helping children around you, and I hope that together we can change the life of many children. And I try and improve the courses every time there's a new update. So please do subscribe so that we can help you get updated with us. And also, being a member, you can ask questions to me or to other members, and we can together help all of these children achieve their best potential.